that with this device, and I want to point that out in the beginning, we have a machine that allows us to get more or less a similar effect like with the CO2 lasers in the dermis. But we don't have the damage from stratum corneum through epidermis to the dermis, and we have no downtime, no wound, and all these risks. So it's very difficult to get such an effect in the dermis without damaging the superficial layers, the layers above. Here we have this. But sometimes this is not enough. Sometimes it's even better to treat the superficial layers, or you need to treat the superficial plus the deep plus the medium to get a full rejuvenation effect that we only can achieve with a more aggressive lasers, but on the other side they have more downtime and more problems. And I'm talking on the new tips that are available to allow you more flexibility in the treatment and to target various layers. Now, so far we have the experience with the needles and the various length, and I don't want to repeat that, where you can go. But now we can go with a small, tiny dots in a separate handpiece that just does some superficial ablation plus some heating below, like we have with other radio frequency devices that are meant to treat the superficial layers and not the depth. But we can combine. Until now, we started with the bipolar microneedles, allowing from 0.5 to 2 millimeters penetration depth in terms of the needles, and also various levels of radio frequency. This radio frequency was limited to bipolar radio frequency, which means it is confined to the distance between the needles, and there you get the necrosis zone and the coagulation. Now this device allows you a monopolar treatment, which pushes down the radio frequency and heat to even deeper layers until maybe even the fat tissue, so you can modify to the depth. But on the other side, you can also modify to the superficial layers. Until now, I used the 0.5 in order to get superficial treatment. But now we have this SRR tip, which is very small, only 0.3 millimeter deep, is attached to the stratum corneum, so it ablates tiny dots in a fractional way, but it's more like a laser peel, however by radio frequency, and you can do a superficial treatment, which is important to also rejuvenate in terms of pigmentation, unevenness and of the skin to achieve some smoothness. And this means this machine now gives you a flexibility and a variability that you don't find in the market elsewhere. And all this without any downtime, because you don't have the wounds. So you can go from deep to very superficial, and not buy a machine for superficial and then buy the next machine for the deep treatment. You have all included, and depending on the patient, the skin type, and the objective you want to achieve, you can choose what kind of parameters you choose. Now the superficial ablation is done by the SRR, and the dermal by the microneedles. You see that? That's the handpiece, that's the difference. This is how it looks like. And this is how the histology looks like, because it's very limited to the epidermis. It's only a very small, tiny ablation, and the rest, you know, it goes quite deep and can be stained and shown. This is in a graphic showing you the difference. Now, using just the superficial tip is like with the other radiofrequency devices, limited to certain areas where you can achieve a result, where you have a thin skin and where this is sufficient. Otherwise you use both in combinations. Now the invasive tip is more for the wrinkles and for the scars, stretch marks, is used for skin tightening. The epidermal superficial, the so-called SRR tip, is more for skin tone, is for skin texture. It doesn't cause hyperpigmentation unless you don't go too high with affluences of too many passes, because you don't heat really the deeper zones, the epidermal zones, where you have this the melanocytes that can cause some hyperpigmentation, and especially it's for the fine wrinkles, and you can use it in combination. The downtime with the invasive tip is, depending on the fluids, is 1 to 3 days. There is pain, but you can control it by applying AMLA, Elamax, air cooling, etc. The SRR tip is very little downtime, maybe half a day, but that's not really a downtime. It's a little bit of erythema. That's nothing actually, and ladies can wear some makeup on that. And there's almost no pain, just a little bit of stinging. Now the SRR is for damaged skin. It improves the skin tone. It's a superficial treatment. It's for the skin texture and large pores, which is important in Asian skin. And as you see in these clinical and histologic pictures, it's not penetrating very deep, but it depends as well on the fluences that you choose. You can choose from more superficial to more impact from the outside to the deeper layers where you can get some heating. So it's not just doing nothing there or just skin care. It's heating the skin, but it's fractionated, so it has not a big downtime. You can do a significant peeling effect on the skin, which might be important for the thin skin. There are various levels. 1 to 2 is a kind of combination if you do a deep treatment as well. 3 to 5 is a basic mode, improving the skin grain and pore with a very little downtime. But if you use 6 to 7, then you get really a deep peel, maybe like TCA but fractionated. But you can do various passes and repeated sessions, so you have less downtime than with the medium deep peels. And you get some tightening in the epidermis due to the fact that from the epidermis, you also heat the epidermis down to the dermis. So this is something in between the needling and the superficial treatment, which nicely can be combined. This is a protein denaturation and a magnification from outside. The indication for this superficial treatment, if you do it only, is the like upper eyelids treatment, very thin skin, neckline treatment, either alone or in combination. Here you can combine with an invasive tip. Very interesting are those thin areas of thin epidermis where you can choose the SRR, or if you don't have it yet, you choose at least the very superficial penetration depth of the other needles. This is like the lower lips, the tip of the nose. You show the tip of the nose and the neck, the eyelids. I think these are the best areas. All the small, tiny wrinkles that you have on the cheeks. Décolleté could be an indication. There is medially the bone and very little fat and other tissue. And so I do, let's say, a 0.8 or 1.0 penetration with the needles, and then you can do the SRR because it's more a matter of the fine wrinkles in the superficial layers. The downtime is very little. Immediately after, as always, you see some redness, but that is gone after half an hour. After 4 hours, you merely see a little bit redness. One day after, there is nothing. This is with a SRR plus 0.8. Usually we go from inside to outside, like in lymphatic drainage, and these areas, like around the eyes, cheek, neck, and the frontal area, décolleté area, are very nice. We can stamp periorally, we can pull up the lids, or pull down the lids so we don't hurt the eyes, and also it does not go very deep. With the SRR you can do that without any problem because it does not deliver any heat to the eye. It's just staying in the superficial layers of the skin. These are patients that I treated superficially. Anterior image showing you the smoothening of the skin. Clinical pictures showing. And what we can do is the layer therapy, multi-layer therapy, using, as I told you before, that we can have a superficial and a deep effect. The best indications are the stretch marks. Usually they respond even with the superficial treatment, especially they're young people, lips, cheeks. And if you need more for rejuvenation and black skin, then you need the deep fractionated microneedling delivered radiofrequency. Sorry, I have a cold. I did a small study on 20 patients, 16 female, acne scars, stretch marks, superficial wrinkles, 5 sessions, 4 weeks apart. Applied some local anesthesia, topically 1 hour before, plus air cooling during the treatment, and did 2 passes. One with 1.5 millimeter bipolar and 1 pass with the SRR, and then we evaluated this. So this is the ordinary handpiece, and severity index that we used by blinded observers. They classified in terms of the wrinkles. These are the clinical pictures, which are quite impressive. You clearly see, and that's not Photoshop, that's a patient who comes to me for Botox and other procedures. And this is a Turkish patient with a darker skin type. We never had any problems regarding hyperpigmentation of the skin, post-inflammatory hyperpigmentation. So you get very nice results of smoothening, stretching, and tightening effects. The score went down from 7 to below 3. See these here around the lips. However, it needs some time. So in this study we had 5 sessions, 1 month apart. That means half a year. You have to give the tissue the time to respond. I don't want to promise you that this is much improved after 3 weeks. If it's much improved after 2 or 3 weeks, then this is due to the swelling and the edema. But that will go away after latest 4 to 6 weeks. But if you want to have a result that really can be maintained, then you have to do that repeatedly. But you will get to the point. Still, you just have to instruct your patient before you start that it will take some time. And this lady is now completely cured, I would say. This young man was very unhappy with his acne scars, and we did repeated treatments. In the end, we did in one spot a 10% TCA in addition, but he was really happy with the treatment after we did all this. Also his back, all the acne scars, all these scars. And this was a lady, she had an accident on her leg when she was a child. That was an old scar, but she was unhappy with the large pores and all this not smooth skin, and wanted to get some smoothing there. And she really responded very, very well. We did only 3 sessions to get a significant improvement. We do a little bit of maintenance therapy, but this is a little bit unusual indication for me. At least we improved, and she had no downtime at all, so that was perfect for her. That's an older acne patient who suffers from acne all the time, and we were able to improve and smoothen the skin. So immediately after, you see a little bit of redness and swelling. 1 day after, this is gone, and 7 days after, there's nothing. But wait up to half a year to get the final result, and try to get good pictures, which is always very difficult to convince the patient, because they forget about how they look like. And, so it might be difficult for you to have them recognize themselves in their previous pictures. One advantage is, I want to point out again, he is very, very low risk of post-inflammatory hyperpigmentation. However, this is depending on the fluences that you choose. And the advantages of the Intracel is that you get the powerful thermal damage if you use the microneedles in the deep dermis, and with a perfect epidermal preservation, no downtime, no wound, compared to any kind of ablative devices. It is much less painful than non-ablative devices. Very short downtime to none. Rare post-treatment complications so far. Thank God I had none. And even a patient, I said that here a year ago, had an immediate flare-up of a herpes after the treatment. There was no problem at all. And dramatic successful results. However, not within 2 days. It's kind of a modulation of the skin that you initiate and maintain, and in the end it's much improved. Indications for the combined treatment or superficial treatment, SRI, can be periorbital wrinkles, stretch marks, acne and hypertrophic scars, rejuvenation, and special dark skin and Asian skin people which respond to the heat with hyperpigmentation. To conclude, I would like to invite you, all of those who are less familiar with the lasers, for European Academy basic course that is also done by the European Society of Laser Dermatology in Bucharest in June. Go to the website of eadv.com or ESLD, and to our meeting, the European Society of Laser Dermatology at the 5-Continent Congress meeting. This is the 3rd, with high-class speakers from around the world, 3 days, 4 days in Cannes. Very nice setting. I would love to see you, and I'm happy to answer your questions.
Thanks, Klaus. All right, any questions or comments for Klaus? Yes.
After initial course of treatment, when would you suggest retreating and how often?
May I repeat the question? How often?
How about retreatment?
Pre-treatment.
When do you retreat the patient? Yeah.
Oh, retreatment, yes. So this is, first of all, is depending on the fluences that I use, and second, I will ask the patient, usually I let them come back maybe after 3 weeks, and then I ask them, how was your response? And if it was 2 to 3 days erythema and swelling, then I probably continue, but it will depend also on the severity of laxity, skin aging. If it's a young person, then I think it could be sufficient to do 3 to 6 sessions, and then I do it maybe every month. So I'm sure they come back. If it's an older skin, then we need, as always, more sessions and maybe more intensity. And I have them come back every second week. So it depends a bit on the response on one side, but also on the indication on the other side.
Actually, what I was asking was, once you've done that initial course of treatment, do you bring them back in again for maintenance treatment?
Oh, I do this completely individual. I don't have a protocol saying I'm doing now 6 sessions at so and so. So I start, as I just mentioned, and then in the end, after a couple of sessions, then we will discuss with the patient how much satisfying this is. Sometimes I even wait 2 more months, and then they come back and they're more happy than before, and then we decide if we do some more maintenance. So that is a decision done individually because the skin reacts individually, but based on the parameters and the facts that I mentioned.
All right. Well, thank you, Klaus. And again, I want to thank the JCS crowd in the back. Thank you so much. And go learn more about this. We really like this machine, all of us that spoke today. So thank you very much.